Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. This is Monday Health Minutes with Valley Health. Genetic testing for cancer has become increasingly popular. It can give you all kinds of clues about your risks and even treatment options and early detection. So we're talking with Dr. Rick Booth about that today. Thanks for being here.
You're very welcome. Thanks for having me.
Yeah, absolutely. It's such a great topic, and a lot of people want to know more about what this means. So what is genetic testing for cancer? How does that work?
It works by telling you what genes you may have in your makeup that will have you at an increased risk for cancer. Some people will just screen folks who have had one or more cancers in their first-degree relatives. Some people offer it to everybody. But basically, you can study up to 274 gene sequences in our body that give us an increased risk for certain cancers: ovarian cancer, prostate cancer, pancreatic cancer.
What can you do with this information once you have your risk factors and know sort of your gene profile? What's your next step?
Well, it can be anything from increased screening if you have a mild variant, to if you have something, there's a gene called BRCA, which is a breast cancer gene. And if you have a breast cancer gene, then they actually could recommend mastectomies and hysterectomies and things like this when you're done with childbearing.
Yeah, that can be scary. Sometimes people would say, I'm not sure I want to know that.
Yes, very scary.
What's your advice to them on that?
It's all up to them. Some people have to know, and if you have to know, we can do it. If you'd rather not know and just roll the dice, you can do that too.
So let's talk about accuracy. You know, with this kind of information, how accurate can genetic testing be?
It's very accurate. It's above 99%. There are very few false positives. So if it says you have this particular gene, you have this particular gene, and then we have to figure out how to deal with it. And then at the same time, there are very few false negatives. If it says you don't have it, then you can rest assured.
Yeah, then you have that sigh of relief that it's off your list of worries. What do you think the benefits are of doing this kind of testing?
Well, the benefits, I mean, it could be life-saving for some people. You know, if I were to test you and you had a breast cancer gene mutation, you know, a mastectomy could potentially save your life. If you didn't do it and you did know about it, then we would just do mammograms every year, breast exams every year. But you know, if you get a problem 6 months before you come in and we don't know about it, it has 6 months to cause problems before we can figure it out.
Right. And it's interesting because so many people have been touched by some type of cancer. They've had an aunt, they've had an uncle, their mom, their dad, even sometimes their children. So to know what your personal risk is too in regards to your family history, that can be enlightening.
Yes. And also for what you're passing down to your children. Because obstetrics is my other profession, so I always have to think about, you know, what are you passing down to the baby inside?
Right, and what can you prepare them for with their own personal health care and let them be ready for it to address?
Yes.
Okay, so the big question a lot of times is, can people have this covered by insurance? What kind of cost factors are there involved?
Almost every insurance will cover it. Some people don't get it covered unless they have met the qualifications of having one or two people in their family. But even people without insurance, they have programs where you can get it, and it's usually on the line of about $149 or $249 at the most.
And should you bring this up to your provider, or how do you go about making an appointment to have the genetic testing done?
You can make an appointment specifically for that. You can do it at your annual exam when you see them once a year. I think most of us are proactive enough that we're bringing it up to them as well.
I know it's kind of a frightening perspective, but knowledge is power.
Yes.
And that way you can make decisions and not be caught off guard and have something sneak up on you. You know?
Exactly.
Know before it becomes, there's so many counselors out there that are silent. And so this can help save lives.
Yes, I agree wholeheartedly. And then when you get your results back, if you don't understand them, they can talk to me. There are numbers they can call to talk to a genetic counselor who's even more in tune with this than I am.
The genetic counselor aspect, explain what that is.
A genetic counselor is someone who studies strictly genetics, and they're versed in everything that you could have come back. So you can have a phone conversation with them, and they can tell you exactly what to do with the information that you get.
So just all of the test results will be understandable and usable for your
Yes.
health. Great. Thank you so much, Dr. Booth.
You're
it's
very
a great
welcome.
topic, and hopefully people will take it and arm themselves with the knowledge they need to be healthy.
We certainly hope so.
We hope so. Thanks, Dr. Booth.
All righty.
Thanks for checking in for Valley Health Minutes.